Why does eye position change everything? So in this video about brain spotting, we will explore how eye position connects to the brain's trauma networks, why brain spotting activates the brain's natural healing mechanisms, the neurobiology behind visual fields and emotional activation, the role of attunement and mindfulness. How do therapists find a brain spot? Why this method is effective for PTSD and anxiety. What happens during a typical brain spotting session? What is brain spotting? Brain spotting is a neurobiologically informed therapy developed by Dr. David Grand in 2003. It emerged from clinical observation. When a client paused their eye movement on certain points in the visual field, traumatic or emotionally charged material surfaced more directly, and the nervous system began processing it in a deeper, more sustained way. So, unlike talk therapy, which relies on cognitive insight, brain spotting works with the subcortical brain, where trauma, emotion, reflexes, and somatic memory are stored. A brain spot refers to a specific eye position that corresponds with an activated neural network. So when someone holds their gaze on that spot, the brain accesses the underlying material and begins to process it naturally. So to understand brain spotting, it helps to understand how vision is wired into the brain. One, the visual field is a map of the brain. The eyes are not just passive organs, they are extensions of the brain itself. Approximately 70% of the brain's sensory input involves visual pathways. So eye position influences the thalamus, the superior colliculi, the amygdala, the hippocampus, the basal ganglia, midbrain reflex centers, automatic nervous system activation. So when you move your eyes, you subtly shift which neural circuits are activated. This is not metaphor. It is anatomical. 2, trauma lives in the subcortical brain. So the subcortex is responsible for fight or flight responses, freeze responses, emotional memory, body sensations, reflexive survival patterns. These systems do not respond to logic or verbal reasoning. Trauma often remains stuck because it is encoded beneath conscious awareness. 3, eye position can activate these networks. So when the eyes rest on a point that stimulates a trauma-related neural pathway, the body reacts. People may feel a pull, a tightening, a wave of emotion, a shift in breath, a sensation in the body. This is how clinicians identify a brain spot, by observing bodily activation linked to a specific visual location. 4, eye position anchors processing. When a client holds their gaze on a brain spot, the brain stays focused on that neural pathway long enough to process it. Eye position becomes an anchor for the internal experience. This is why eye position, something simple and subtle, can influence deep trauma resolution. So how a brain spot is found. So there are 3 main ways that therapists identify a brain spot. A is the therapist observes reflexes, or known as outside window. In this technique, the therapist slowly moves a pointer across the client's visual field and observes reflexive responses such as blinks, swallows, shallow breathing, facial tensing, eye movement freezing, sudden emotional expression. These reflexes indicate that the eyes have landed on an activated neural network. A client reports a sensation, or known as the inside window. So the client pays attention to internal cues such as tightness, emotion, body heat or cold, pulsing, vibration, shifts in energy or affect, while the pointer moves across the field. The client will then say, yes, that spot feels stronger, or that feels like something is happening. C. Client finds it naturally. Okay, and that's what they call gaze spotting. So sometimes clients will spontaneously look toward a particular area when discussing something emotionally charged. That spontaneous gaze often reveals the brain spot. Now, why this matters. So once the spot is located, it provides a direct, stable access point to the neural circuitry holding the unresolved material. The eye position becomes a portal into the deeper brain, not metaphorically, neurologically. So the role of the subcortical brain in brain spotting. So brain spotting works primarily with the midbrain and limbic system, and they store procedural memory, emotional memory, reflexive survival responses, somatic sensations. These systems operate automatically without conscious thought. When trauma is stored in these regions, talk therapy alone may not access it. The conscious mind cannot override the survival circuitry that formed during overwhelming experiences. Brain spotting bypasses the thinking brain and goes directly to the systems that need the healing. So key areas involved include the amygdala that detects threat, encodes fear, hippocampus links memory to context, insula processes body sensations and interoception, the periaquedical gray, a key center for freeze, shutdown, and brain responses, basal ganglia, motor attention and procedural patterns, thalamus, sensory relay hub. Eye position influences activation in these networks. This is why brain spotting can reach trauma stored as sensations, not stories. So brain spotting relies on two simultaneous forms of attunement. One, the therapist attunement. The therapist provides a grounded, regulated presence. This helps keep the client within a tolerable range of activation. Two, neurobiological attunement. Eye position attunes to the neural activation point. The brain remains focused on the internal target. Together, these create a safe environment for deep processing without overwhelm. Unlike highly structured therapies, brain spotting allows the brain to lead. Processing unfolds naturally, often with minimal talking. Clients may experience body movements, emotional release, memories shifting, deeper breaths, tremors or shaking, insight emerging spontaneously. These are signs that the subcortical brain is reorganizing itself. Eye position is not just a direction of gaze, it is a neurological signal that influences activation. Looking at a brain spot stimulates an associated neural pathway. Access. The brain becomes more able to reach material stored outside conscious awareness. Focus. Processing is sustained because the eye position keeps the brain oriented toward the target. Depth. Many people report that brain spotting reaches deeper layers of trauma and somatic memory than other modalities. Regulation. Staying with the spot and the therapist's attunement allows the nervous system to stay within a workable range. Processing efficiency. By not shifting eye positions rapidly, the brain can unfold experiences in a slow, steady way. This supports integrative healing instead of reactivation. So how does brain spotting help PTSD? Well, PTSD involves stored survival responses, and these responses are often automatic, somatic, emotional, nonverbal, linked to visual, sensory, or reflective cues. So brain spotting helps because it accesses the trauma where it lives, not in thoughts, but in midbrain networks. It activates the nervous system's natural healing mechanism, similar to REM sleep processing, but you're awake and regulated. It reduces hypervigilance and reactivity by resolving the brain's unfinished survival responses. It works even when memories are unclear because the method does not require a narrative. It supports emotional and somatic regulation, which allows clients to return to a more balanced baseline. So what does a brain spotting session look like? So often it'll include a brief check-in at the beginning, identifying the emotional or somatic focus, locating the brain spot, then holding gaze on the spot, allowing the body and brain to process, observing shifts without forcing anything, and closing with grounding and stabilization. And other things clients may experience in session is the increased awareness of sensations, emotional movement, waves of activation followed by calm, deep relaxation, spontaneous insights, and release of tension. Now, processing can continue after a session. People do process between sessions, so it can happen for a few hours or days afterward as the brain reorganizes itself. So brain spotting demonstrates how a simple shift in eye position can open access to deep neural networks that store trauma, emotion, and somatic memory. By combining precise eye position with attunement and mindfulness, brain spotting allows the brain to process unresolved material in a natural, regulated, and efficient way. And this is why eye position truly does change everything.